But as the BBC says, over 50s much more likely to die in general. But the question is, where do the estimates come from? It comes from this, the MRC Biostatistics Unit at the University of Cambridge and Public Health England as well. The latest modelling suggests that COVID-19 vaccines have prevented 7.2 million infections and 27,000 deaths. Now, this is what Sajid Javid was talking about on Tuesday when he was giving his briefing to the House, that it's based on the latest computer models. Now, is that a reasonable thing to claim 27,000 deaths? The fact is, they have no actual evidence for that whatsoever. But the other thing that I just want to point out is this is, they're claiming that they've saved 27,000 deaths, but they've avoided 27,000 deaths. But actually, we have 27,000 real deaths, which are additional excess deaths going on at the moment. So if we take this period that they're talking about from the beginning of the year until now, if we look at the latest ONS statistics and look at the people that are dying at home, which the ONS themselves say are not dying from COVID or any connection to COVID, and we look at this as excess mortality, these are extra deaths above the 5-year average. If you take from the 1st of January up to date, that comes out at around 25 to 27,000 people. Those are people that are really died because they didn't get the health care that they needed or for whatever reason. So this is, my question is, therefore, if they're claiming that they've saved 27,000 lives as a result of the vaccination rollout, how can they do that when what we're seeing on screen at the moment is 27,000 people that have died in their own homes because they haven't been able to get access to their general practitioner, or they've got an acute condition that's been going on for a long time and they haven't had medical treatment for it because the NHS has been reoriented towards the vaccination program, which wasn't necessary in the first place. And the NHS has been reoriented towards COVID, and therefore waiting lists have extended to the point of destruction for the NHS. That's 27,000 roughly people that actually died. And whereas the government can only provide a model that says that they've saved 27,000 lives through the vaccination program, I think there are a lot of questions to be raised out of this whole thing.
The original BBC text that you put up, the last paragraph, I don't know if you can show.
I can show that. Yeah.
Show us that really quickly. The original text.
Was it this one?
The original. Yes. Okay. The last paragraph, Mike. If you look at the last paragraph, because most fully vaccinated people are over the age of 50 and therefore are more likely to die, while most unvaccinated people are young and healthy. They've just made the case there not to vaccinate the youth because you're introducing a new risk with an unlicensed experimental vaccine. The BBC has even admitted they've undermined their own case, Mike, in their own argument. They've totally undermined it there. They've admitted that there's a very low risk for young people to even get ill of COVID, much less ever die of it. If you look at the statistics, I mean, the lower you go down in age, according to their numbers, it gets more and more and more obscure. So they've made your argument for you there. So introducing mass vaccinations for young people, which is an argument that even people and some government officials and MPs have raised this issue. Why are you introducing another risk, especially if it's unlicensed and it's experimental pharmaceutical product?
Which brings us to this Daily Mail article. Gloomy Sage advisor calls for school restrictions to remain until all children are vaccinated.
Who could they be talking about, Mike? Who is the gloomy sage advisor? Oh, it's none other than John Edmonds there. So he's saying that all the children need to be jabbed in order to ease restrictions. So there's no other alternative, according to John Edmonds from the London School of Infectious Diseases and Tropical Diseases. But actually, we've got the clip from the BBC. Let's listen to this.
Well, I mean, at some point we do have to dismantle all of these measures that we put in place. I think the time, for me, the safest time to do that is when children have been vaccinated. Certainly, secondary school age children, at least. That's the safest way. That's the way that.
Is that what you're advocating? I mean, would you say it is now time to vaccinate children?
I think if the vaccine can be, if we can show that it's safe.
If they can show that it's safe.
Why don't you do the safety bit during the clinical trials over a period of 3 or 4 or 5 or 6 years? Isn't that what we normally do with regulatory procedures with pharmaceutical products? Is that the normal
That would be the normal
protocol?
thing to do, yes.
So we've thrown all that out the window, right?
Yes.
Why? Because
It's expedient.
there's a pandemic on and people are dropping dead in the street, on the sidewalk. What's going on here? So this argument is just getting more and more ridiculous. So John Edmonds, he of Sage fame. So we just went and did a little search regarding the London School of Tropical Diseases, Infectious Diseases here. And this is actually the Bill and Melinda Gates website for grants. And we found a few, about 145 grants there for the London School of Hygiene and Tropical Medicine there. I think that's where John Edmonds works, right? So just in the last 2 years, Mike, you're talking about circa 40 million pounds, okay, or dollars. Sorry, is this dollars?
Yes, dollars, yeah.
It's dollars. But if you go back 15 years, it's, there's another page here. It's a lot of money. I mean, maybe in total we're in excess of 200 million, possibly. This is kind of Imperial College level funding.
Yes.
From the Bill and Melinda Gates Foundation. So think about the agenda that the Bill and Melinda Gates Foundation were pushing so aggressively at the beginning of the pandemic, and then look at the words of John Edmonds throughout the so-called global pandemic, and you'll see that they're very, very much streamlined there. So we're asking, do all those tens of millions of dollars have anything to do with John Edmonds's prescriptions there for various interventions? Does it have anything to do with the amount of money flowing into his institution? I don't know.
It's a good question.
It's a fair question to ask.
But other stuff going on in schools. We're heading over to the United States for this one.
Sure, sure. Well, this is a nice photograph here of the children in little Perspex plastic boxes. So the title of this segment, Mike, Children in Plastic Boxes. Who put them there? Well, the CDC, the Center for Disease Control. That's the Ministry of Truth for all things pandemic in America. But let's look at this. What happened? Well, it turns out, Mike, the CDC lied on its recommendations, on its guidance.
Never.
For prescribing these Perspex plastic boxes for schools. I mean, in terms of peak lunacy, this has to be right at the top of the list. Putting these Perspex boxes around children to what? Keep them from transmitting the virus. Statistically, we're looking at the numbers, Mike, in terms of risk to children of even getting a cough from the coronavirus. It's around 0, okay? So why roll all this out? This is a multi-billion-dollar industry, along with the rest of the PPE industry. So everyone who made money on this has already cashed in. Let's just take a look at this. In mid-March 2021, the CDC released new guidelines, which removed the recommendations for barriers between school desks. Greta Massetti leads the CDC's Community Intervention Task Force. I love the sound of that title. And said about the plastic shields, we don't have a lot of evidence of their effectiveness in preventing transmission. So, they do the mask mandates for the kids. They're putting them in plastic boxes. And now there's a load of people, including the teachers' unions in some countries, clamoring to have the children jabbed in order for school to be safe. So I think the problem is not with the kids. I think the problem is with the adults. Where are the adults in the room with this conversation on schools and children? Because I have not seen any. We have not seen any. But Joe Biden made a visit to one of the local schools here recently. I think we've got that clip here. Joe's going to inspect these barriers, and he's very impressed, by the way. Let's look at this.
Well, I tell you what, you guys are impressive. Really impressive. This is 9th grade, right? Oh, no. It seemed like 9th graders were smart. Tell me, what do you do? I mean, what do you focus on in terms of Is it mostly projects to get them associated with what they're learning?
This one, that's okay. Maybe we can fix it.
That's probably my fault. I probably walked by it closely.
That's been one of the challenges of this year.
Oh, yes.
There we go. Are you okay? You weren't scared, were you?
You don't look like
That's okay.
So the biggest hazard in that classroom was clearly
Well, I would say on multiple levels, the biggest hazard in that classroom was Joe.
it's Joe Biden.
Yes.
We're not just talking about knocking over perspex boxes either, Mike. So again, the whole thing is based on science fiction, like so many other mitigation measures and creative sort of solutions that have been floated over the last 15 months. But look at this, little bit of pushback here, Mike. This is the Telegraph. Recently, there's Laura Donnelly here calling for end the madness in terms of isolating children. The government's warned. So Telegraph's launching this campaign to put children first, etc. We like the sound of this. The general, intent here, I think, is very good. So what's happened here, Mike, with the schools? I mean, you've got kids being thrown into quarantine because some teacher either tested PCR positive or another student in the cohort tested PCR positive.
Well, as we reported on Wednesday, and actually it's now in the mainstream press today, children all over the country are faking the positive test by using fruit juice with the lateral flow test, which creates a positive result, and they're getting their entire classes sent home. I mean,
or
well-
testing their pets. Oh, we'll get on
we'll
to
get
that
on to
in a
that,
minute.
yes. Yes, okay. Now, if you like what the UK Column does and you would like to support us, then please head over to ukcolumn.org/community, and there are options to help us there. And also do share our material on the various platforms. Now, I received an email yesterday or the day before, and it said this. Great to see you at the weekend. That was the march at the weekend. I'm increasingly concerned about about controlled opposition. We know the Kill the Bill and Extinction Rebellion are controlled opposition, but I'm getting more and more sponsored ads on Facebook from Liberty and Amnesty International. The context of these ads focus on the Police and Crime Bill having another reading on the 5th of July. That's on Monday. These are huge multinational organizations who do a lot of great work. However, the obsession with the right to protest, which Kill the Bill focuses on, makes me very nervous of their actual objective. We have seen Extinction Rebellion and Kill the Bill trying to infiltrate our marches, as you've pointed out on your news reports, and also have seen them myself joining the marches. I would love to hear your opinions on these types of organizations and where they fit into the picture. Now, no sooner had I received that email yesterday than I got a phone call from Joe Boyd. And so I'm going to say, welcome to the program, Joe.
Afternoon, Mike. Afternoon, Patrick.
So, Joe, we've mentioned you on the program before. We've done a pre-recorded interview that we've had on the program before because you are particularly interested in this police and crime bill at the moment and the implications for protest. And you've also, as it happens, written a book about these types of groups like Extinction Rebellion and some of these larger groups. So I thought you were a perfect person to have on for a few minutes to discuss this. So before we talk about controlled opposition and the types of groups that are implementing that, just bring us up to date with the police and crime bill. It's getting its third reading on Monday. Is that correct?
That's right. Yeah. So this is the final stage before it goes to the House of Lords. So what I would say about the bill is protecting the corporate state. That's at its core. That's what it is really. It's like the main part of the bill for me that I focus on is this distinction between assemblies and demonstrations, because the demonstrations are the controlled opposition, because everything's agreed with the police beforehand, where they're going to march to, what time they're going to march, when they're going to march, etc., etc. Whereas with grassroots protest, which could be anything, anywhere around the country, is nation state protest in a sense, because it's issues that involves local democracy. And what we found during the anti-fracking movement with the quadrilla protest was there was controlled opposition, which for me is the corporate state, and they speak to the police, have negotiations with the police, how they're going to protest, they're not going to disrupt, etc., etc. But on the same hand, like outcasting